or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Happy Thursday, everyone. Welcome to You and Your Doctor, brought to you by All County Healthcare. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. You can reach them at 954-717-7027 or info@allcountyhealthcare.com. I'm excited because tonight we have a new guest joining us. We have Dr. Alice Brumley, ready for her 21 initials. She is Doctor of Nursing Practice at DNP, APRN, AGPCNP-BC, and we're going to explain all of that. But basically, she's a Doctor of Nursing Practice. She's the Interim Director of the Lewis and Ann Green Memory and Wellness Center, which is part of the Christine E. Lynn College of Nursing, and she specializes in geriatric primary care. Dr. Brumley is a board-certified Adult-Gerontology primary care nurse practitioner dedicated to advancing the health and quality of life of older adults with specialized expertise in cognitive health and memory care. She earned her Bachelor of Arts from the University of Florida, her BSN from the University of Miami, and both her MSN and Doctor of Nursing Practice from Florida Atlantic University. As Director of the Lewis and Ann Green Memory and Wellness Center at Florida Atlantic University, Dr. Brumley leads interdisciplinary clinical and community-based services for individuals living with memory challenges and their care partners. Her work focuses on comprehensive cognitive evaluation, proactive care planning, and evidence-based caregiver support approaches. Central to her doctoral research, she is committed to innovative, person-centered models of care that uphold dignity, promote connection, and enhance quality of life of those navigating memory challenges. They are located at 777 Glades Road, Building AZ-79, Boca Raton. Their phone number, the direct line to the Memory Center, is 561-297-0502. And wait, there's more, because we're very excited to have Dr. Brumley sitting right here with us. Unbelievable, the opportunities that are offered right here in our community. Welcome, Dr. Brumley. Thank you so much for joining us.
Thank you for having me. This is such an incredible opportunity. I'm so grateful to be sitting here with you and talking about all of our love for our community.
It is such a pleasure. And with all of your degrees, Doctor of Nursing Practice, you are the Interim Director of the Wellness Center. Mm-hmm. Why did you go into gerontology? You're young and with so many things going. Why gerontology? Why elder care?
Oh, well, I really couldn't see myself in anything else. I like to tell people it picked me. I actually went into nursing as a career change when I was in my young 20s, and I was very interested in pediatrics. And when I went in to experience that, I froze. It was not for me. I was absolutely terrified. So when I started working as a brand new nurse, I was working on a unit at Broward Health Hospital, and there I was with a lot of older adult patients, and we just connected. I was always that nurse that the managers were saying, get her out of the room, she's talking with them for too long, on to the next task. So I just found a deep connection with just very engaged with older adults, hearing their stories. I can't get enough of it. So that's what led me to actually go back to school. Because when I was in the hospital setting, I could see how there were a lot of older adults coming into the hospital with a lot of problems, especially a lot of people who didn't have a lot of family support, and they were kind of stuck in this cycle of coming back into the hospital, many of them with cognitive changes, memory changes leading to dementia. And so I became very interested in pursuing further education in that particular arena. So that's what led me down this path.
In the Lewis and Ann Green Memory Center, it is located right here at campus, FAU campus, near Boca Regional. Tell us what makes that so it's a standout place in our community.
Yeah, so the Memory and Wellness Center, the Lewis and Ann Green Memory and Wellness Center, we are actually one of the 17 state designated memory disorder centers under the state of Florida.
Wow.
So it is a really prestigious center. We are a nurse-led center, which makes us very unique. So we bring in that caring science principle. We are part of the College of Nursing in Florida Atlantic University. So we have we're very research-driven, very evidence-based driven, and extremely community-minded. So we are looking to serve the community and constantly bring the newest methods and be a resource hub for our community and work with all of the amazing medical community in South Florida. We're very lucky to have here.
It's really interesting that it's nursing driven as opposed to corporate driven or administrative driven or anything. You're not even under the Baptist hospital. You're a standalone huge facility.
Yes, we are. We have a clinic and we have a adult day program, and this is actually specialized under ACA as an Alzheimer's disease and related dementia specialized adult day program. So we have Monday through Friday, we have services from 9 to 4 p.m. where individuals can come and have very engaging activities throughout the day to help promote their brain health and support engagement, socialization, cognitive, physical, so that their loved ones know that they're well supported and we can kind of maintain their cognition for as long as possible.
Is it a drop-off daycare?
It is. It's a drop-off, and we have nurses, social works, and activity assistants that participate with our what we call participants throughout the day.
What would they need to qualify? What type of patients can come?
So you do have to have a dementia diagnosis, and dementia is actually, a lot of people may not realize, dementia is an umbrella term that describes a set of symptoms, and there's many different diseases that can cause dementia, one of which a lot of people know of is Alzheimer's disease. That's the leading cause of dementia. About 60 to 70% of cases are related to Alzheimer's disease. So you do have to have a dementia diagnosis to meet criteria in order to be at the center, and you would just call us and come in for a tour would be a great place to start. And we also offer a couple of days of free trial visits so that you can see if your loved one, just to understand and feel what the atmosphere is like.
And if they, I guess, pay is under Medicare, does insurance cover it?
So actually Medicare does not cover it. It is private pay. However, we have an incredible relationship with Boca Regional Hospital Foundation, and they do provide a subsidy program, so we do have scholarship. And we also have a foundation called the Caring Hearts Auxiliary, and they do tremendous work in raising money from the amazing Boca Raton community to support those scholarships. So we really don't need to turn anybody away.
And what if you don't have an official diagnosis of dementia, but you're looking at your loved one and you just see changes, right? There's natural aging changes, and then there's the point where you say, it's either natural aging or there's more. I think my loved one needs a diagnosis. Do you work with that as well? Do you help with diagnose?
Yeah, that's a very good question. So we have a clinic, and that's our memory disorder clinic, and we're an excellent place to start if you're having any of those concerns. And so we have a memory evaluation process where you'll first meet with one of our nurse practitioners, and then if appropriate, you'll have neuropsychological testing, which I can talk more about, and then you'll have a full comprehensive care plan developed, and we will help to point you and your family in the right direction. So whether it's the early changes of something happening, or it could just be that you're noticing changes, but it's a part of normal aging. We'll talk about that. But sometimes it could be something more serious like a dementia process, and we will guide you in the direction of getting a proper diagnosis. It's very important to get a good diagnosis because that will guide the treatment plan. So there's a lot of different treatments available depending on what disease process is causing these cognitive changes, and knowing that, we can then connect you with the appropriate people in the community, like neurologists or specialized neurologists, depending on what changes we're seeing.
It's interesting because I was going to ask, because sometimes you look at your loved one, you see mom or dad, they're changing. They can't really sit through the days and the battery of tests. So you think, it looks like a duck, acts like a duck, we see memory changes, but you're saying it's really important to get that clinical diagnosis.
Yes. Yeah, so exactly, you can, and that is actually a big reason, I would say more than 50% of the people that come in don't notice the changes themselves, and they are being encouraged by a loved one, like their spouse or their adult child, because they are noticing the changes.
Sure.
Because that is kind of a red flag symptom in certain disease processes that cause dementia, that you may not have the insight that something's changing. So you really ought to trust your loved ones, because they do notice all of these nuances and these, changes that are happening. And the earlier the better. I know it's a very scary process. Nobody ever wants to go through, dementia is an incredibly scary, to the thought of losing, your mind and your ability to think and maybe parts of your personality. That's an incredibly scary and vulnerable process.
How long is the process? The diagnosis?
The diagnosis, it can depend. However, for our process, about 3 weeks, about 3 to 4 weeks to go through our full process, because you do have several visits, because we have to obtain a lot of information. We look at everything. We try not, nurses are really good at that. We're very good at being comprehensive and considering everything. So we collect a lot of information, we analyze that, and then we work with an interdisciplinary team of nurses, social workers, and neuropsychologists to really dive in and figure out what could be going on here.
And what about agitation, right? Sometimes it's brand new and the patient, they're agitated. If you ask them a lot of questions, because they know often that their memory's changing, and you can see the workaround, and they think they can maybe fool their spouse, and it'd be like, oh yeah, I know your name, remind me what is it again, or something like that.
Yeah.
And then there's that level of agitation. How do your specialists and your team of nurses help get through this process when that happens?
Yeah, so I think a big part of that nursing approach is the care and the compassion. We really try to approach this and really try to, each person and each case being very different.
Sure.
We have to really consider how to approach each individual and their family unit. So we really try to consider that. We try to take it slow. We try to get people to understand, to get them on board, because we're not going to force anybody through anything. But there's usually, we can talk through this and figure out the best way to approach it. Now, some of those personality changes, or behavioral changes we call them, are an unfortunate part of the disease process. So some people might have agitation. They can come in and say, my mom used to be such a nice person and now she's super irritable and mean. And so we try to guide through that, because the ultimate hope is that we can try to address those behavioral changes to get that person to have the best quality of life possible. Because a lot of time with the dementia process, you can't reverse it, but we can try to maintain it and try to treat the symptoms.
And I would also think the caregiver, the spouse, the reason they may not see it, they probably do see the changes, but then it's the denial. It's, do I really have to admit to my kids that mom or dad is changing, that I can't handle it, or I don't want to, I should, right? You make your vows, I will love and care, but then it's, well, there's accidents, there's cognitive changes, there's incontinence changes, and a lot of that's got to be really hard to admit, and to admit to a facility to come in. Do you have caregiver support as well?
We absolutely do. We know that the caregiver is, that there's just so much need there, and we have seen in research that caregivers are at a very high risk of their health deteriorating faster than their loved one, because of the stress that is involved with being a caregiver, a care partner to someone. Psychologically, physically, it can be quite exhausting, and you need that support. And one thing that's really important for people who are caring for a loved one to know is that self-care is mandatory. It's not an option. We constantly say, oh, you need to take care of yourself, and try to support that, but you really have to realize that it is mandatory, or else you are at risk of kind of crashing and burning. And there is a way, that's why we try to provide support. So we have several support groups that are offered by our licensed clinical social worker and other social workers at the center, both online, which really makes accessibility for a lot of people, especially those that are still working or if they're stuck at home with their loved one. And we also have in-person support groups, and it really fosters a sense of community. You can meet other people that are going through something that you're going through, or they might be further down the road and they're able to teach you about what to expect, or it's tremendous. It is so beautiful to witness that just the shared experience of these caregivers. That's one of the most rewarding things for me in this position, is to work with the caregivers.
We're going to take a quick commercial break. More to come from All County Healthcare, you and your doctor. On the other side of this break, we're going to talk about some other things that are happening at the Lewis and Anne Green Wellness Center, Memory Care Center. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency serving Dade, Broward, and Palm Beach County. Reach out to them for any information, or if you or your loved one needs services, at 954-717-7027 or info@allcountyhealthcare.com. Tonight we are here with Dr. Alice Brumley, who is a DRNP and ARNP, DNP, Doctor of Nursing Practice, talking about the Lewis and Anne Green Memory and Wellness Center right here in Boca. We've talked about some of the services that you offer, but let's talk about the care plans. But before we get into that, the memory care evaluation that we talked about, daycare is private pay. The memory evaluation, you say, is covered by Medicare.
Yes, so at the clinic, and we have an array of services at the clinic, we have the memory evaluations, and we also have psychotherapy available, hosted by our licensed clinical social worker, but both of which are covered by Medicare or by your insurer. So if you're having any suspicion or worry or concern about whether some changes are happening, take advantage and come into the clinic and we can have you evaluated properly. And if we don't accept your insurance for whatever reason, or if you don't have insurance, we also have subsidy or scholarship available for those individuals. So we rarely have to turn anybody away, which we're very pleased about.
It's so great to have this so local in our community to serve the area. And one of the 17 places in Florida to do this. I mean, right here in Boca, which is unbelievable. Definitely reach out and for these services. Once the diagnosis is made, a long-term care plan, how does that work?
Yeah, so that is formulated by our interdisciplinary team, and then the nurse practitioner is who you'll meet with to receive that care plan. And we always encourage to have your family involved, because this is definitely the type of disease that affects the whole family. So everybody should be involved in discussing, because there's going to be changes over time. So the care plan, we try to individualize it as much as possible. We talk about how to keep your brain healthy. That's another big big component of what we try to do, and the knowledge that we want to share is what are things that you can do, and this is from any age. I mean, brain health starts now. It starts before you're born, but it's never too late to start and make changes to foster a healthy brain and to reduce your risk factors of developing dementia later. And in that care plan, we're going to give you an array of resources. So whether that's care in the home, whether you need assistance with finding care outside of the home, like moving to a facility, whether it's diet related or medication management, family planning. If you need to meet with an elder law attorney, we really try to give you as many resources as possible in the community. There's cognitive rehabilitation, how to train your brain, like physical therapy, but for your brain. If psychotherapy, if you're dealing with feelings of depression or anxiety, which can exacerbate cognitive changes, we want to address that. And then depending on the diagnosis, let's say we're suspicious of an Alzheimer's or a vascular dementia, and you're not already seeing a neurologist, because we do work hand in hand with many of the neurologists in the greater community, then we will help you to get in with a neurologist, because you need to have further evaluation and possibly treatment. Like, for example, with Alzheimer's disease, there's new and upcoming and expanding infusion therapies that can help to reduce the amyloid plaques that are building in the brain. So, we really try to be a resource hub and guide you and your family to the next steps. And it's not an ending point. We're always going to be there and available. We encourage people to come back, keep in touch with us. And there's many of our patients that just kind of become part of the Memory Wellness Center family.
I was going to ask, so once you have the diagnosis and your spouse is getting support, or the family members, and then you have this care plan, is the care plan done within the Memory Center? Do they come back and they say, all right, you're nursing, these are the meds you're going to be on? Or do they then go to the different physicians and different therapies around the community? Or is it mostly hubbed where you are?
So we collaborate with your full care team.
Okay.
So we actually don't do any prescribing, and that is specifically because we don't want too many hands in the pot. That we need to be, your primary care provider really should lead the ship on that one, and or your neurologist for those specialized medications. So we make recommendations, and we collaborate directly with those offices to try to facilitate your best care and treatment, because we know that the system is very hard to navigate. Sometimes it can be a very long waiting period to get in with a neurologist. So we really try to expedite that process, and a lot of neurologists send their patients to us for this evaluation and for the resources. So it goes both ways. So we really enjoy being able to work with the greater community, because the services that we offer are very unique and very supportive, so we can complement the medical community in what they're doing.
Your resources are so comprehensive, and I have a loved one who's in memory care. He's in a facility, but for the spouse, it was really hard to actually make the step to put him in a facility. He couldn't go through the testing because he got too agitated. So the family just said, all right, this is where we have to put them.
Yeah.
But the support group for the spouse, because once his memory had deteriorated to such a degree that now you're looking at spouse support, and
yes.
It's like losing your loved one twice. Is what we were talking about. You're losing them once in the mental capacity and everything you loved about them, but physically they're still present with us. What does that look like for support through your center?
Right. That is why support is so important, because going through that alone is tremendously difficult, and they don't need to go through that alone. There's, whether you just want a community or if you need that more individualized support, please reach out, because you're not alone. And that's what's really important to know, is that this type of thing can feel very isolating. It can upend. I mean, like we were talking about, you go into a marriage early in your years and you till death do us part, in sickness and in health. And this can be very unexpected, having to put your loved one in a care facility, and you're not, that's very, very difficult. And there's a lot of people that are going through that. So it's important to create a community and see there's still so much joy that can be gotten out of life, and there's still so much potential in that. Even though that relationship looks different with your loved one, there can be so much quality to come out of it, and we want to be that guide and that support for those individuals. Mm-hmm.
What about the Lewis and Ann Green Memory and Wellness Center stood out to you that you said, I'm going to become the interim permanent director of this 15,000 square foot facility? This is huge. This is a huge undertaking.
Yeah, I was first introduced to the center because I was a student at the Christine Eland College of Nursing, which I'm very proud to be. And it's amazing. It's so exciting to me to still be in my hometown, serving the community that raised me and that I circled back to it. I feel so honored. I feel privileged for that. I was a doctoral student at the center. That's my exposure to the center, and I just was blown away. Really, truly, it's the people there. We have such an incredible team, and it is such an honor to be able to lead them and to pave the way for caring in our community and in this space in dementia care and geriatrics. It's a very difficult space to navigate, and we just every day. We get along so well, and it's very uplifting to me, and I can't see myself doing anything else really. I love it. I can't even describe it.
All right, they tell me I've got about a minute. Fun fact about you that nobody knows that you want to share.
Oh, fun fact about me. Let's see. Well, I'm expecting my first baby.
Congratulations.
Yes, I am little Lucy. She'll be here in April. So I'll be stepping into motherhood soon and balancing a career and motherhood, and I'm excited for it. I'm nervous, of course, but I feel extremely supported by the College of Nursing, by my team at the center, and it's very exciting.
Amazing. Congratulations.
Thank you.
Thank you so much for joining us. The best contact number, 561-297-0502. Contact them. You can get in touch with Dr. Brumley right there. That is the main center for the Lewis and Anne Green Memory and Wellness Center. The main number right here in Boca Raton. Your resources are incredible. Thank you so much for joining us. It's been a pleasure.
Yes, thank you so much.
More to come. Hopefully you'll join us again and let us know what else is going on. Thank you to All County Healthcare for sponsoring you and your doctor. Again, to reach out to All County for any information in the Tri-County area, you can find them at 954-717-7027 or info@allcountyhealthcare.com. Have a great evening, everyone. Happy Thursday, and until next week, we'll see you then. Bye-bye.
Bye. Oh, cool.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsor.
At Coriander, we bring you